Hi, good night, everyone. Welcome to another episode of Tuesday Talks with the Movement for Social Justice. Tonight, we're very pleased to have with us two officers from the Trinidad and Tobago Registered Nurses Association. We have with us Comrade Letitia Cox, the second vice president, and Comrade Sharon Lacken King, the secretary of the northern branch of the association. Welcome, comrades.
Thank you for having us.
Okay, so the exciting news story coming out of the weekend was the very unfortunate ending of the event on Saturday, where people came out to say that they were pro-choice and they were not happy about the vaccine mandate that was proposed by the government. Can we just start with your union's take on that, or the JTUM take on that, if you can speak to that?
I will start. So good night once again, and thank you, Fabiola and Comrade Abdullah, for once again having me. And, you know, I brought along with me Sharon Lacken King, who you would find with a wealth of knowledge. And in Bacchanal starts, we use colloquial language here tonight, if you permit me. The Bacchanal starts on the 18th of December 2021, when the Honorable Prime Minister made a statement that he is going to implement safe zones within the public sector and state agencies. So that is where all the confusion started. And in response to that, I know the Joint Trade Union movement would have issued a letter, an official letter to the Honorable Prime Minister, dated the 21st of December 2021. And I just want to highlight some of the things that was written in that letter. Right, the JTUM, to our President General, Comrade Ansel Roger, would have written at the press conference. You indicated that by mid-January, all government places of work shall be deemed safe zones, and all public servants will be required to be vaccinated against the COVID-19 virus, and in lieu of which they will be denied access to their place of work and be followed. And of course, when they mean followed, they mean that they're going to place persons on leave of absence without pay. So that was Bacchanal in itself, right? And I just want to state that the President General would have been emphatic even since the previous Labor Day to state that the Joint Trade Union movement is pro-vaccine, but we are pro-choice. So I just want to say that just before I go into some of the statements that was made, because I would want to remind person of what JTUM's position is. One, that this proposed measure is tantamount to the disguised implementation of mandatory vaccination through the circumvention of proper parliamentary debate. Okay. So there was this whole discussion. You are trying to have safe zones, but that means you're infringing on persons' individual right to choose if they want to have this this vaccine within their body. Yes, you are infringing on that right. And of course, the Constitution is clear on rights and what needs to be done. And there's the whole conversation where the Legal Minds was talking about if there would need to be a 3/5 majority or two-third majority if this happens, right? So here it is, the government, through the Prime Minister, is making this statement that they have this intention to do this, and they're telling persons that they have to declare their vaccination status without the law, mind you. Two, JTUM would have stated that this proposed measure is a blatant breach of good industrial relations practices, a violation of the labor laws and industrial relations jurisprudence of Trinidad and Tobago. They went on to say that, to be more specific, this proposed measure will be a unilateral variation of the terms and conditions of employment of existing public servants, whereby these said terms and conditions will be varied without consultation with the workers and or their representatives, resulting in a breach of existing labor law. Yes, so we have, you wanted to say something, Fabiola?
No,
You feel
that
like
just sounds so. There were things that are in place. I mean, a lot of people might not know what the labor laws are, but the people who maybe should know what the labor laws are and what needs to happen would be the parliamentarians.
you think they would, right? So, you know, I know documents that section 40, 43, which speaks to the recognized majority union and collective agreements, and the fact that employers should consult with the RMUs before making decisions like that. But here it is, the Prime Minister and the Attorney General had the conversation, and they don't have to go through the normal industrial relations channels, because it doesn't speak to what they are attempting to do, because it's a pandemic. So in essence, what they're saying is a pandemic, so we could do what we want, right? Persons' rights, democracy is out the door. So that's the conversation. Anything goes in a pandemic. And I believe that was a very dangerous statement and a dangerous perception to go through. It's not just because it's a pandemic that all rights are thrown out the window. No, it's not. Yes. And Four went on to say, pardon me? Yes. Four went on to say that, you're hearing me?
Yes, yes.
Yes. Four went on to say that until there is empirical evidence to show that a vaccinated person cannot contract and or spread the COVID-19 virus, then taking the vaccine must remain a matter of personal choice. In the absence of evidence that the vaccine will eradicate the virus, and the fact that all other safety protocols must be maintained, especially where the vaccinated is just as dangerous as the unvaccinated. The vaccine then is simply for personal benefit and must remain a choice. Yes? So what they're saying is this, and it is true, it is not a lie, that both if you are vaccinated or not, you can still transmit and you can still be infected with the virus. The science says that you have an added layer of protection once you are vaccinated. And to that, vaccinated. So I just want persons to know, those who are listening, yeah, I am fully vaccinated. So I am pro-choice, but I am also pro-vaccine. And when we understand, the World Health Organization has statistics that persons who are more susceptible or immunocompromised may need to be vaccinated every 3 to 6 months, because they realize that the vaccine may not last longer than that, the time span. So that is why the conversation about boosters are here right now. Yes. So I wouldn't go on to the length and breadth of the letter, but it is safe to say that JTUM is stating that the government, the employers, still have an obligation to observe the existing laws, to honor the existing terms and agreements of a worker, and to also honor Section 40 and 43 of the Industrial Relations Act, and I will also union Section 51, 2, and so forth. Yes. So yes, that is the joint trade union movement's position. I don't know if you want me to go straight into the Trinidad and Tobago Registered Nurses Association position, or you would want to ask me any questions before
as you talked about the need to meet and treat and to have consultation with the recognized majority union, what has changed then since Saturday's announcement that they are pushing back? Are they now finding time to meet and treat? Does it make a difference? Is it enough time?
I don't believe what has happened is that they would have realized that that time frame that they would have given and the announcement that they would have made was premature. Without saying, oh gosh, I put my foot in my mouth. They you know, they went in front of the country and said, yes, we will give at least one more time, and I've instructed the AG to take a little time, and I've appointed this committee. And you know, we must congratulate the President General Ansel Roger and the Joint Trade Union Movement for pressing and actually stating openly that they need to appoint an independent panel And I will talk a little later about that independent panel. We have some information on that independent panel, but we were happy to see that the recommendation that was openly made by JTUM, they listened to it. And we believe it's because of the direct advocacy of the joint trade union movement and other interest bodies that the government would have pulled back, realizing what they did was premature and they needed to take a little more time to do the necessary consultation, look at the statistics, real statistics, because some really good questions was raised. How are you really tabulating the COVID deaths? Is it really genuine COVID-19 specifically alone deaths you're tabulating? Or is it that even if a person comes in with another substantive illness and they die, that you record it as COVID-19, and the person may have very well died from the substantive illness and not the COVID-19. So there was that conversation that the statistics are skewed. So with regards to that pullback, I believe that pullback was because of our advocacy, our consistency, and the fact that we put out there very relevant points that they could not deny. They could not deny. There was no real genuine consultation. And still, we are calling on them to have genuine consultation with the federations. There are federations here, there are unions here. We are here for the voiceless, we are here for the working class, and they should consult us. And one thing I would like to highlight is the fact that for some reason, we all know this, we study sociology, we looked at the class system, we look at Marxism, we look at the different things, we understand that the persons who are in the high strata of society tends to have sway, yes? And we see it glaringly with the Prime Minister when he made the statement and he said, well, we looked at the Chamber's recommendation and we look at this, and you realize Chambers is the business community who controls the wealth of the society, and you looked at them and you praised them, but they would want to know that the exemptions is not anybody doing it, and and these kinds of things. But you did not speak to, with a level of respect and value, the organizations that represent the average worker in society.
Yeah,
so it is very
I noticed they have a trend, sorry for interrupting, I noticed they have a trend of speaking on behalf of the nurses and other healthcare workers, and nurses have a union. Nurses can come out and say what they think and what they want.
Yes.
Maybe can we bring in Comrade Sharon to talk about the TTRNA perspective, maybe?
Yes, you can, and she would have.
I think we're very interested in hearing from the nurses what you think, what you are seeing. Comrade Sharon?
Are you hearing me?
Yes. And to our Facebook audience, if you are having any challenges, please let us know. Please, Comrade.
You hearing me?
Yes.
Okay, great. Wonderful. Good evening to
yes, we're hearing you, Sharon.
Comrade Cox, Comrade Abdullah, and the viewership. Yes, TTRNA does have a position. We had issued our notice earlier on following the Prime Minister's announcement of the furloughing of public sector workers, and of course nurses they fall right in that group. We had issued our statement on January 5th, 2022. And we are also, while we support vaccination, we are also pro-choice, and that has been our resounding statement throughout. Quite a number of us in TTRNA, quite a number of the TTRNA membership are vaccinated. However, we stand in solidarity with our colleagues who choose not to be vaccinated. And we believe wholeheartedly that it is the individual right to make that choice accordingly. It's my body, my choice. It's the same statement that is made for abortion. My body, my choice. And many other situations, it's my body, my choice. So we are pro-choice, but we are also pro-vaccine for those who choose. to have the vaccine. So we had issued our statement on January 5th, 2022, advising our membership that just as Comrade Cox had said earlier, there's no law currently that is approved policy that empowers the regional health authorities to mandate that existing employees provide proof of vaccination as a term for the payment of their salary and or continued employment. Secondly, the nursing personnel, whether vaccinated or not, are advised to report for duty even after the deadline. Well, it has since passed and pushed back to the mid-February. But regardless, we are advising our members continue to go to work. Continue to go to work and report the name of any supervisor or manager who prohibits them from assuming their duty on any particular day. And we have given our contact number so that we can be informed of what is happening on the ground when these mandates, if it should be implemented at all.
Okay.
Yeah.
Okay, it's interesting for me to hear that anybody can have this position of being vaccinated and pro-choice, because when the announcement was made, two reactions were very, very loud in the newspapers, on social media. You're either anti-vaccine or you want everybody to get vaccinated. So it has taken some time, but it is really interesting that we have now another position that you can be vaccinated and still understand that somebody else, for whatever reason, is choosing not to get vaccinated.
Yes. Being pro-choice does not mean anti-vax, and this is probably a very common confusion that is happening out in the public domain. Being pro-choice does not mean that we are against vaccination. We support it. We support any measure that will assist in the fight against COVID-19. However, we also support the fundamental human right of an individual to make a choice. It is each of our choice whether we want to or not. All right. Similarly, we have a lot of emphasis is being placed, like Comrade Cox had mentioned earlier, about persons succumbing to COVID-19. And yes, we are wondering whether these statistics are as it is and not convoluted. When you look at the global figures that are published every day, we have even the Ministry of Health daily figures of total number of infected persons from the inception of the pandemic in Trinidad, compared to the number of persons who would have died as a result. You do a quick little bit of math and you come up with approximately 3% of the infection figures die. And the whopping 97% thereabouts either recover or in hospital, as the case may be, but they are alive.
Okay.
So I think we need to look at those figures, and it's not just in Trinidad, that's the global figure. When you look at the World Health Organization's website, they have a daily dashboard, and you can look at the numbers and do a quick little bit of math, and you find that there's much more alive, whether infected or in hospital, as the case might be. And just this 1 point, according to the World Health Organization, it's approximately 1.68%. When I check it out today, 1.68% of the total persons who would have been infected are the persons who die.
Okay. Of course, every life lost, is someone who was as well and is missed. And we also extend our condolences and our solidarity to those who have lost loved ones.
Yes, and nursing has lost a number of our nurses and ENAs and healthcare on a whole has lost quite a number of persons. So we
Wow.
do stand in solidarity with those persons.
I do have a few more questions about the politics and the industrial relations side of this, but as we're talking about vaccines, is there anything that either of you would recommend to people in the audience that they can do to layer their protections?
Apart from vaccination, because both vaccinated and unvaccinated have to observe the protocols, which include social distancing. So when we look at the Swiss cheese model of protection, social distancing is one of the layers. We also have staying at home when you're ill or quarantining as a layer. We also have mask wearing as a layer. So you wear a mask when you're going out or if you're quarantined. We also have hand washing and cough etiquette and refraining from touching your face, and so that's another layer. We also have the sanitization of your environment, high touch areas, and so on. So we have all those things that whether you're vaccinated or not, we all still have to observe them. And those have been found to be rather effective in minimizing infections. And what I remember from last year, one of the reports that last year in the Ministry of Health noted that because of the implementation of these protocols, there had been a drastic decrease in the number of persons coming into hospital or the health facilities for simple flu and stuff like that. So it has been proven to be quite effective. And there are those who would like to add the other layer of vaccination to it.
Okay, that's really interesting. You know, the idea that, yes, you can have one kind of protection, but then you can have
multiple layers.
Yeah, and you're safer when we're safer when you do that.
Yes.
Okay.
I also want to add something to that, maybe.
Please, go ahead.
Sister Sharon was very succinct in highlighting all that you have to do, and actually that's one of the most important things, because even when we go into the COVID-19 environment where we are caring for critically ill patients, it is very important to maintain those protocols, whether vaccinated or not, when you patients, because any break in the chain of that, meaning when your proper PPE, taking it off what we call done and duffing, if it's not done well, then you know that the virus will get onto you and you have that high risk of contracting the virus. So it is very important. One thing I would like to see in places, we need to look and review the spacing in our workplaces. We cannot have persons crowded together. In our workspace, in the union, our work stations are separated quite well. So, you know, you don't have employees too close to each other. They wear their masks upon interaction, and there's little to no in terms of congregation. We limit what we do in terms of socializing. And we have socializing, but when we do it responsibly, where there's sufficient space, washing hands, and so on. So persons don't understand how important that is. You know, hygiene practices and social distancing is very important. Yes, so I just wanted to highlight that.
Thank you for saying that, because I think with so much focus on vaccination, we have in the national conversation, I think we are forgetting some of these things as well that can keep us safe. Social distancing, hand washing, simple measures that our nurses are now telling us really work and are working to keep them safe in our hospitals. So thank you so much for that insight.
Yes, have you?
Directly from the source, from people who are dealing with this. Hello? Sorry, you were saying something?
Sorry about that.
No, go ahead if you wanted to add something.
Oh, I wanted to add that in 2020, before we even got vaccines underway, that is what had helped us quite a lot in the healthcare setting, maintaining those protocols. And even now that we have vaccines, we still have to observe those protocols.
Okay, so nurses in their workplaces, hospitals, health centers, and so on are still maintaining those protocols.
Yes.
So we have to ask, maybe another Tuesday talk, we could ask the question, are other workplaces also maintaining their protocols to keep people safe? Because this advice needs to be applied to everyone, that they are maintaining social distancing in their workspaces too. So that's a very interesting point. Thank you very much for sharing this information with us. So we've been talking to officers from the Trinidad and Tobago Registered Nurses Association, Comrade Letitia Cox and Comrade Letitia Cox, and Comrade Sharon Lacan King. So to our Facebook audience, if you have any questions for us, for our panel, please put it in the comment section and I will be happy to read them out for our panelists.
Viola, I don't know if we're going to discuss the committee, but you let me know when.
Sure, I was going to get back into my prepared questions. So sure, we can talk about that. So there's a committee announced by the Prime Minister that will be investigating some aspects of the healthcare in Trinidad and Tobago.
Yes, so the Prime Minister, you want me to go ahead with that? Yeah.
Please, yes.
Yes. So the Prime Minister, in his announcement that, you know, he would have been extending the time frame, I think it's to the 17th of February, sir?
So far, yes.
Yes, I think it's the 17th of February. He would have also announced that he's going to appoint a 5-individual panel of experts to investigate, the factors contributing to clinical outcomes of COVID-19 patients. That's exactly what was said. And I just want to quickly state the names of the persons and what their designation is. So we have Professor Terence C. Mungle, PhD, Doctor, Professor Emeritus Phillips Pitt Miller, MD, Doctor, Consultant Anesthetist, and so forth. Dr. Anton Cumberbatch, Medical Doctor, Dr. Vidya Dean, Doctor, Professor Donald Simeon, PhD, Director, Caribbean Center for Health Systems Research. And we will call that person an intellect. That wasn't a doctor. So it's not a healthcare professional, but somebody with expertise in health systems and research. Okay. So we looked at it, and one thing we saw was missing. They're talking about they want to investigate the clinical outcomes of COVID-19 patients. Where's the nurse? Where's the nurse? Where is
as
the
you were
nurse?
saying it jumped out. Wow.
Right. So it's not that we have a beef with the doctors, quite intelligent and well-renowned doctors who are there, part of the panel. Some of them I know. One of them is actually was my family doctor at one point. So we have no problem with the doctors. But what we are saying is this. Nursing makes up more than 70% of the healthcare workers' population. So we believe that at least one of our nurse leaders, and we have quite intelligent, quite qualified nurse leaders who we could have been chosen to be a part of this distinguished panel to really have an objective clinical assessment of what is going on within the health environment. We fear that perhaps the data may be skewed if it's looked upon in the eyes of just only the doctor and a research analyst. You'd still need that perspective and that representation from the healthcare force that makes up more than 70% of your healthcare workers. But why a nurse? I wanted to take it from that point of view. You say, where would the nurses just move bedpan and give tablet? Them and really know nothing. First thing first, we have been taking straw and making bricks for many years in the hospitals. So when you see a nurse, we are magicians. I just want you to know that. We are miracle workers in the healthcare system. So when you see it, please tell them thank you for being a miracle worker. Because sometimes when you come on a ward and they tell you you have to nurse 20-something or 30-something patients and it's you alone and one assistive staff, You are
Oh my
creating
goodness.
miracles, okay? You're taking straw and you're making brick. So I just wanted to put that out there. So that's just one reason why a nurse should have been considered in this panel, because we have a very unique, intimate understanding of what really happens in the healthcare setting. And we are the ones who have been helping them manage very little and scarce resources. So if your miracle worker is working miracles for you in the healthcare system, don't you think you need that innovative miracle worker on your panel to help guide you in terms of what would be best for that area? Yes, you
That
need
makes sense to me.
yeah, you know, you go
But
ahead,
this is also
Fabiola.
why I said earlier, it's so important for us to hear directly from the nurses rather than having people who are not nurses try to speak on behalf of them.
Yes.
Because we did not get this message or any part of this at all from the official communications that we've been getting.
Exactly. And we really wanted to highlight this this error in judgment from the government, from the Prime Minister when they were appointed. And we hope that they fix it. Because I heard the chairperson, I believe, of the panel said they may ask in an article. I don't know if it's so true, because I think their deadline was this Saturday coming here. I believe
Yes.
this week deadline. So I heard him say they may ask for additional time. And I am saying that it's not too late for them to actually appoint a member of the committee and have a nurse on that panel. I want to really highlight workers in the healthcare system, and I'm very serious. I hope you're hearing me, because I see the internet unstable.
I'm hearing you, and I think our audience is hearing you too. Yes.
Right, good. The establishment, what nurses have done, the establishment of formal nursing education, which directly affected healthcare outcomes within Trinidad and Tobago. There was a time when nurses did not have formal education.
Okay.
And nursing stalwarts that came from our organization, the Trinidad and Tobago Registered Nurses Association, names like Yvonne Pilgrim, they are now retired, Bernice Dolly, God rest her soul, she's now deceased, were very instrumental in nursing education, standardizing that so that we can have the kind of nursing that we are seeing now in Trinidad and Tobago. And trust me, we have come a long way. And we're not talking about the few persons who may have had bad encounters with nurses. Most of our nurses operate at a very high level and are very experts in what they do.
Yeah.
So we're not talking about the dissidents, talking about the ones who operate and function and really do what they're supposed to do. And thanks to our past nurse leaders, we have contributed to that. Our Nursing Council of Trinidad and Tobago, which is our regulatory body, the TTRNA, our nursing stalwarts, Bernice Dolly, they formed the Nursing Council. The Nursing Council regulates who should practice nursing in Trinidad and Tobago. If they are not there, it means that persons who are unqualified, unskilled, inexperienced could come and do nursing and care for your family and loved ones, and they don't know what they're doing. That body protects that interest, the public interest. Nurses was instrumental in that. Yes? Yeah. I would also say that we have also been instrumental. The present executive of the TTRNA would have lobbied in 2018, 2019, 2020 through a Nursing Now campaign to have ILO 149 recommendation 157, which speaks to nursing personnel ratified. And when that is ratified, you will see a cataclysmic change in healthcare within Trinidad and Tobago that is going to improve. And we as nurses did this. And I would also want to end with saying that Port of Spain General Central Block, when you come in, when you walking and you see big construction taking place there, remember a few years ago when we had the earthquake? Yes. That hospital, that Central Block was condemned by PAHO many years ago. And when they had the earthquake and they saw water more than flour, using a lot of colloquial terms today, I want to express myself, right? Yes. Crack in the building. TTRNA lobbied, and with the support of our membership, we were able to get that Central Block condemned, removed our nursing and healthcare workers from that area, and they are now rebuilding there. So why nurses? Nurses are instrumental in the development of healthcare within Trinidad and Tobago, and we should have a seat everywhere that they are talking about healthcare and policy. We should have a seat. So I just wanted to add that bit of information.
Okay. Comrade David Abdullah has a question for you all. Is the TTRNA making representation for a nurse to be on the committee? And is the TTRNA submitting any recommendations to the committee?
We have actually, a letter went out today, fresh off the press, to the Prime Minister from our president, stating our, our displeasure in the fact that a nurse was not chosen to be a part of that committee. And yes, we have intentions to make the necessary recommendation to the Prime Minister regarding the healthcare system and the clinical outcomes, because we have a lot of information to provide to them. Yeah. Mm-hmm.
Okay. Can I ask, what are the working conditions like for nurses, both physically and in terms of employment?
I want to
Sharon, can you handle that one?
Yes, I was now going to say Sharon.
Okay.
You hearing me?
Kamran, are you there? It's a little soft. Kamran Sharon? Okay, we're not hearing her, so maybe Comrade Cox, if you could just start us off and see if we can hear her.
Okay, so some of the conditions that nurses pre-pandemic and which continues into the pandemic is chronic short staffing.
Okay.
We have been working with a limited number of nursing and midwifery personnel even before the pandemic started. And one of the contributing factors is that the hiring practices of the regional health authorities leave little to be desired, especially the NCRHE. They are giving you, they were giving 6 months, 1 year, temporary, and they keep renewing those temporary sort of arrangements. And those arrangements are not very attractive to banks and mortgage companies and so on. So the standard of living that a nurse and a midwife would want, they can't live because of what they have been offered by their employer. And that is not good. If you're saying this, nurses and midwives are valuable, are critical, are healthcare heroes, how can you then decide not to give them job security? So even before that, and because of that, nurses are deciding to leave Trinidad and Tobago. We have exodus. I know there was an article that I would have done with the Newsday, where we highlighted at least 100 nurses would have left in 2021 and migrated to the UK, Canada, and US. And it's directly because they were dissatisfied with the terms and conditions that they were working under.
Okay.
The other thing that with regards to staffing, and I know Comrade Abdullah would have wanted it raised, is that the community nurses are under a lot of stress and burden. We are not getting to do proper contact tracing. So when somebody contracts COVID, many times you hear people complain that I got tested positive for COVID, but no one has ever contacted me. No one has called me to find out how I'm doing or who is my primary contacts to quarantine them. And they're saying they go through their whole cycle with the virus and have never been contacted. And that is because our primary healthcare system has broken down significantly because it's under-resourced. If you have
I didn't even know community nurses were a job that we had.
Yes, they're called district health visitors. Have you ever seen them in their khaki? Their khaki?
Yes, but you they're not many of them, and I can't imagine what it's like to try and be doing that kind of work under this level of stress.
And why we don't have many programs for training for district health visitors or community nurses. The RHs are reluctant to release persons to go and do the training because it means it will deplete their hospital working staff. So they may just release 1, 2, or 3 persons to do the program. So therefore, you already have short staffing. And then when the pandemic took place and you realize you had so many infections coming in, and you only have this amount of DHVs to do calling, surveillance, and so on, you realize the flow in your system. Yeah.
And we're hearing a lot of talk about comorbidities, that the conditions that a lot of people have already in this country can make your outcomes worse.
Yes.
But the district health visitors, am I correct in thinking that they are supposed to be helping people manage those chronic conditions?
Yes. Are you hearing me well?
Yes, I'm hearing you.
Okay. I'm getting a feedback, but
okay.
Yes, the community nurses are primary healthcare deals with health promotion and prevention. So in the community, you are supposed to, educate the citizens on how to stay healthy, eat right, exercise to prevent illness. That's the main goal of primary healthcare. And what you're seeing, the research says, the statistics says that persons who are immunocompromised, which is that you have diabetes or hypertension or asthma and so forth, you are more susceptible to severe illness and even death if you contract COVID-19. And what needs to be encouraged is healthy lifestyle. So yet again, the importance of primary healthcare is underscored. You need to empower the community healthcare environment, the resource, give them what they need in order to help with the prevention, educate persons on how to stay healthy, how to live right. That's the whole reason and the ideology behind the Enhanced Health Center. They have nutritionists, they have, they used to have, I think they had like gym machines and so on. When they started off, it had all those things there. So persons can do screening, so persons can exercise, so persons can have, the right to be able to understand what is the right diet in order to reduce, to avoid obesity. And even if you have things like diabetes and so on, how to eat right if you have hypertension and so forth. So we really need to empower our community health care system. Yeah,
we really do. And as you say, that's a function of hiring practices and the way we're treating the nurses as workers in the health system. Can I bring in some questions from the audience?
Sure.
Comrade Sharon, is the situation with your audio a bit better? Unfortunately, that's not working out.
Maybe she could come out and come back in. Sharon, try to come back and come back in.
Yeah, we can see if that works. Comrade David Abdullah says, the collapse of contact tracing is contributing to the greater spread. Also, the absence of a quick turnaround of test results in the public healthcare system. Also, that the government's abject failure to keep our nurses here in T&T by making sure they at least have a permanent job.
Yes, and he is correct. And I think the government recently realized that they had fallen down on the job with not increasing testing capacity, because persons need to know their status. Yeah, they need to know their status, and then they would be able to take the necessary precautions to prevent the spread. Yeah.
Okay. And Comrade Sati Gajra, Ines, Comrade Sati, welcome. What would be the impact on the population if the government implemented vaccination for all government workers? It's a very broad question. Are we speaking medically? Yes. Well, we're talking to nurses.
The impact? I would believe the impact really is public trust and confidence. The World Health Organization in April of 21, they would have published a paper regarding the pros and cons of mandatory vaccination. And they were giving both sides in that what it could do, the benefits of it, and then the drawbacks. And they warned the governments against taking the decision to implement mandatory vaccination because it will erode public trust and confidence. And they encourage government that is actually a very last resort if you choose to do that, because the public won't trust you again. If they don't trust the integrity of the vaccine, if they do not trust that it will help them, then and you force them to take it, then they would resent you. They would resent any policy. They would resent anything that you do, and then it may have implications for them coming down the road where elections is concerned, right? But you want persons to actually buy into the fact that they will have greater protection if they accept the vaccine, and that's the route you'd want to take. And the World Health Organization guides in that that's the route you want to take. And something I would have raised in some interviews a few weeks ago is that they need to do group-specific campaign. They cannot use a broad brush for everybody. If you're speaking to healthcare workers, you have to speak to healthcare workers because they are a different grouping. They would have been exposed to certain education, certain things. So you have to speak to them in their language. There are persons who have specific fears, yeah? So you have to may affect their fertility. They are hearing stories that it affects your menstrual cycle. You need to bring in a specialist, an obstetric specialist, a gynecologist to come and speak to that and say, if it's, you know, these situations are irregularities, or no, you don't have to fear. You need to bring in those specialists. What about the protective services? They will be speaking a different language. They were exposed to different training, how they will develop, you know, and you need to speak to them in their language. So if the government really put aside ego, put aside the fact that they want everybody with a PhD or the what have you, and they actually sit down and they speak to the grassroots, I think they would fare well. All right. One
Really
moment. I don't know, Sharon. Go ahead, I'm listening. Yeah.
I think, Sharon, are you talking?
I think she's soft. Yeah.
It's not working. It's so sad because it's so, you know, we're so happy to have you both here with us to explain these things and to speak from the nurses' perspective.
Mm-hmm.
But I was going to say it's really sad that. Sorry, you say something?
No, go ahead. If you want, we could continue with the conversation.
In December, they were saying it's a crisis, an emergency. We have to now is the time to act. And then right before your own deadline, you come to say, okay, we need more time.
Yes.
I think that time could have been used differently. That time could have been used differently, and the input of the Trinidad and Tobago Registered Nurses Association could have been brought in at a time when a point in the process that might have been more helpful for everyone concerned.
I think too that the government and even the Minister of Health and the Ministry of Health look at the nurses like as though I can be wrong, but I assume that they look at us as though we are betraying them and betraying what they are doing because we are speaking out, because we are healthcare professionals. So you hear this thing that they should know better, or you know, they should be on our side talking about getting the vaccine at any means necessary. But that's not what it's about. One of the roles of the nurse is to be a patient advocate. We are I don't know if the internet is. Hello, you hearing me, Fibula?
I heard of the patient advocate.
I said one of the critical roles of nurses. Yes. Right. So we are patient advocates, and you know we have that advocacy role. So even if when a patient comes to us in the hospital, we know about informed consent, and we are not supposed to force something on a patient if they don't want it. They have that right to refuse. Yeah, they have that right. So we believe in maintaining the integrity of a person's right to choose. Yeah. And that is ingrained in us. So it's not anything about betrayal. It's about our understanding that everybody has their constitutional right to choose. And there are alternatives and ways for those persons who want that right to be maintained so that they can protect themselves and protect others in the instance. Right? Yeah.
Another comment from Comrade Quintrim. What about the health centers? Some of them are lacking pharmacists, so persons in the communities are not getting medicine. Is that something you
Well,
could speak about?
well, yes, from time to time, and I believe because of the demand for drugs right now, and the fact that many many clinics have been
Mm-hmm.
closed within the hospitals, so persons are being sent, into the health center. They have to go and get their medication in the pharmacies. So is there that demand? So there may not be any hospital setting per se, but we have a high demand of persons seeking to get their medication. So of course, that is actually affecting the demand and supply. And I know within the healthcare system, we tend to have periods where medication sometimes is scarce. And then you have the sole, I wish Sharon could help me with, there's a contractor, there's a person who they take their medication and supplies from. I'm trying to remember. Sharon, your volume is working to tell me that the name of them, right? They sometimes don't have supplies, or it doesn't come on time, and therefore it would not be supplied to the health centers. And that is what C40, right? C40 is the company. Yes, the government has a contract with C40 to supply drugs. So yeah,
All
sometimes they don't have, and when they don't have, it means everywhere has none. And they can't
Wow.
order from anywhere else because they have that contract with C40.
Oh my goodness. So maybe that procurement law
Yeah,
might
they
make a
can't because
difference
they're locked in. Yeah, and
if we
then
ever get it.
there's this problem now where the RHAs sometimes don't pay on time to their suppliers. So the suppliers tend to withhold supplying things until the payments are made. So this is happening in the healthcare system. So that is where
So
sometimes the nurses
sometimes
just
when
have to
people
make.
say, I know, I mean, we know what happens, that some people say the nurses are a little rough and say we don't have this and we don't have that. But it's not the nurse's fault. She's just, the nurse is the one at the end of the line, the end of the supply chain to say, you're the ones talking to you directly to say that supply chain broke down and there's nothing we could do at this point.
Actually, people even go as far as making the statement that we taking the drugs, or we taking the supplies and we taking it home. I've seen statements like that under captions on social media. And it's really sad because I know nurses put up money to buy Panadol. I worked on a ward where a patient had a bed sore, and we had to use a particular medication, a particular ointment on and it's expensive, right? And the pharmacy ran out of it, and we know the patient needed it for the wound to heal faster. You know what we did? We put up and we purchased that ointment. Yes, and so that patient would have that supply until the pharmacy could supply it. Do
Oh
you know
my
there are
goodness.
nurses right now in Monto, pediatric, taking care of children who are abandoned on the wards? It's like they're the ward child. They take care of the baby on the ward because the baby was abandoned there, and the nurses bring clothes for them. They help the baby, they take care of the baby, they comfort. You don't hear or see this side of nursing. You don't hear about it. There are nurses right now, they may be listening, they may see the recording, and they will understand. There are nurses right now taking care of abandoned babies and children within the hospital. I am telling you again, and I will repeat, we always making brick with straw. Nurses and healthcare workers are miracle workers within the healthcare system.
Comrade, you touched my heart there, I don't know how to react because that's just so, but I was going to say that we have been talking for almost an hour. It's been a wonderful conversation. So thank you so much for your insights and your expertise. Do you want to make any closing comment? Or we also wanted to find out how your members are doing, the members of the TTRNA are doing. So if you could just give us a little quick overview and then maybe we could wrap up.
I would like to say in nurses, there's so many things going on, and this whole safe zone, quasi safe zone, just compounded all that is going on, because we were already dealing with the fact that the Minister of Finance would have reneged on his promise to provide permanent employment to those on contract and short-term and temporary arrangements. They breached their promise. They did not and didn't even have the courtesy to write or let the association know that maybe there's a delay or there are certain things that are being done. It just was not addressed. Now we want to say emphatically that a 1-year contract or a 3-year contract, as I heard the THA secretary announced that they're giving the workers 3-year contract, it's not job security. You still cannot do much with a contract. The bank's going to look at it and say your employment is not secure. We cannot give you a mortgage. And if we give you a loan, you have to pay that loan off into in that 3-year period or that 1-year period. The installments are very high. So in essence, we are the working poor. So we say that, you know, there's so much going on with nursing and midwifery right now. They are disappointed. And then now you come and you compound it with the fact that you want to take away a person's right to choose. So nurses feel disheartened, they feel betrayed, they feel used, because our dear Minister of Health was walking around during Christmas time giving us a pan of biscuit. I mean, thanks, I mean, in the little late night, you know, the little sugar might you know, pick you up a little bit when you're working 1 o'clock in the morning. Not
same as a permanent job, though.
Yes, right. He was walking around smiling with a pan of biscuit. And that had an outcry from all the nurses. Who taken that? Why they smiling with that? Why they accept that? You know, but we so gracious, we so kind. That's the way we are. We don't want to make nobody feel bad. And then the manager on the side, hey, go and smile and take the pan of biscuit. So the manager, the supervisor who on the contract, now telling you go and smile and take the biscuit and take the picture with the minister, right? So what we are saying, we ask on organizations and groups such as the MSJ and other interest group and persons who are hearing us right now, even on your Facebook pages, call out your members of parliament who are on your pages and you know, the government officials, and say, please treat your health workers good. I'm not only talking about nursing personally, doctors are being ill-treated. Just the doctors who are coming on are getting the same treatment too now. The junior doctors can't even talk because the senior doctors and them dealing with them. You can't behave, so you can't say that. You can't, you know. And we have the other workers, the attendants, the maids, who even reach out to TTRN and they message our page and say, oh, let's say something for us. Don't forget us. You know, say something for us. They do that. They call us and they say something. We are suffering too. And healthcare workers are suffering. We are suffering. And that's my tip to save lives.
So
all
after
right?
so many thank yous to essential workers, frontline workers, their gratitude was just words. There's no substance, there's no action to take care of these frontline workers who are putting themselves on the line, who have suffered losses to keep healthcare running and to keep us all safe.
Yes, very true.
Comrades, thank you so much for taking the time to talk to us. Thank you for showing us both the workers' issue side of it and the health aspects of it, and sharing your experiences as frontline workers. It's so great to hear directly from people and not hear it filtered through somebody else's priorities. So this was Tuesday Talk with the Movement for Social Justice with the Trinidad and Tobago Registered Nurses Association, Comrade Letitia Cox and Comrade Sharon Lacken King. Thank you everyone for joining us. Thank you for your feedback and be safe and good night.
Thank you.